Colon cancer is often associated with rectal cancer, and both conditions are grouped together under the name colorectal cancer. This condition affects 1 in 23 men and 1 in 25 women. Superscript 1. It is the second most deadly type of cancer among men and women combined, and it is the third leading cause of cancer death among men and women separately. Colon cancer can be controlled when diagnosed early. Therefore, it is useful to know what signs and symptoms to look for. While these symptoms are not limited to colon cancer and can be caused by other conditions, it is essential to pay attention to changes in your body and seek medical advice if you experience any of the following symptoms. 1. Persistent changes in bowel habits. Frequency changes, an increase or decrease in the number of bowel movements might signal changes in the colon's function or structure. Chronic alterations in bowel habits should be thoroughly investigated. Consistency changes. Changes in stool consistency, such as persistent loose stools or constipation, may indicate disruptions in the digestive process, warranting medical attention. Caliber changes. Noticeable changes in the width or caliber of stools, particularly if they become narrower, could signify a potential obstruction in the colon. 2. Blood and stool. Bright red blood. Visible bright red blood in the stool often suggests bleeding in the lower gastrointestinal tract, possibly from the colon or rectum. Dark, tarry stools. Melena, dark or black tarry stools, may indicate bleeding higher up in the digestive tract, with the blood undergoing changes as it travels through the intestines. 3. Abdominal discomfort. Cramping and pain. Persistent abdominal discomfort, cramps, or pain may result from the tumor's impact on the colon's normal contractions. Inflammatory processes can also contribute to discomfort. 4. Unexplained weight loss. Metabolic changes. Unintentional weight loss may be associated with changes in the body's metabolism due to the presence of cancer. The body may expend more energy as it copes with the tumor's growth. Nutritional impact. Colon cancer can interfere with nutrient absorption, leading to weight loss despite a regular diet. 5. Fatigue. Anemia. Chronic bleeding from the colon may lead to iron deficiency anemia, causing fatigue. Anemia reduces the blood's ability to carry oxygen, impacting overall energy levels. Systemic effects. The body's response to cancer, including the release of inflammatory signals, can contribute to generalized fatigue. Moment. Subscribe to the channel if you like the content and like the video because this will help the video spread more. 6. Iron deficiency anemia. Chronic bleeding. Tumors in the colon can cause slow, chronic bleeding that may go unnoticed. This can result in iron deficiency anemia over time. Symptoms. Iron deficiency anemia symptoms include fatigue, weakness, pale skin, and shortness of breath. 7. Narrow stools. Obstruction sign. Narrow or pencil-thin stools may indicate a partial obstruction in the colon, often caused by a tumor constricting the bowel's passageway. Altered bowel motility. Changes in stool shape can reflect disruptions in normal bowel motility due to the presence of a tumor. 8. Incomplete evacuation. Obstruction or motility changes. Feeling of incomplete evacuation may result from a tumor causing a blockage or altering the normal rhythmic contractions of the colon. Increased straining. Individuals may experience increased straining during bowel movements, even when the volume of stool is small. 9. Abdominal bloating. Tumor impact. Abdominal bloating may occur due to the physical presence of a tumor or disruptions in bowel motility. Digestive changes. Changes in the colon's ability to move stool efficiently can lead to gas accumulation, contributing to bloating. 10. Unexplained vomiting. Obstruction consequence. Obstruction in the colon or rectum may lead to vomiting as the body attempts to expel the contents that cannot pass through the blocked area. Systemic distress. Vomiting, especially if persistent and unexplained, may indicate systemic distress associated with advanced colon cancer. It's crucial to note that these symptoms may also be associated with various other health conditions, and experiencing one or more of them doesn't necessarily mean you have colon cancer. However, if you notice persistent or worsening symptoms, it's advisable to consult with a healthcare professional for a thorough evaluation. Early detection and treatment of colon cancer can significantly improve outcomes. Regular screening tests, especially for individuals with risk factors, are also important for early detection and prevention. At the end of this video, subscribe to the channel if you like the content, and put a like on the video because this will make this video spread to the largest number of people who need help.